Okay, so continuing with the bed occupancy rate, so hospital bed is an important and cost-effective resource for all health systems. uh, there is seen that there is a direct correlationship between overcrowding and over occupancy of bed numbers and scaling up of hospital infections because of less hand hygiene, more frequent transport of staff between the ward, and less care for the isolation and hospitalization of patient in the unlinked segment, leading to the failure of maintenance of patient safety against hospital infections. So this statement directly tells what I have explained in the previous video also. It tells you that as soon as the occupancy rate goes up and the overcrowding happens, the the infection rate in the hospital goes up, and the infection rate goes up. Why? Because first of all, there will be less hand hygiene because the workload of the staff will get tremendously increased. There will be more frequent transport of the staff between the wards, and there will be less care of the isolation, and then the failure of maintenance of patient safety against hospital infection. So these are the things which tells that there is a direct correlationship between overcrowding and over occupancy of bed numbers. Unnecessary occupancy rate of the bed. So what happens if there is an unnecessary occupancy rate of the bed? You are not ready for performing the routine patient test before admission. There will be longer time to send the physician instructions to the laboratories and receive their results. The longer time of discharge and settlement of patient account for any reason. Failure to coordinate the provisions of unnecessary equipment or surgical procedures. Cancellation of the operating room for any reason, and admission of patient with disease that are not curable in terms of medical sciences. So on all these points, you will notice one thing is the mismanagement. That means the hospital management is not efficiently working because of unnecessary occupancy rate. The longer the time, if the physician takes longer time to send the instructions to the laboratory or for the treatment of the patient, the longer time the patient will stay in the hospital. The longer time it will take for the discharge, because there will be overload of the work into the whole process, right? There will be cancellation of the operating room for any reason. Why? Because the number of lined up patients will be many, and since because of the mismanagement or of the information and all, the operating room or the operation of the patient might get cancelled for any other reason. Then so these are all the points which shows that it's really very important that the hospital maintains an optimal level of bed occupancy rate, which we'll be discussing in the next lecture, that what has to be the minimal occupancy rate. Because if we go for less, that means it's a revenue loss, and if we go more, then again it's a revenue loss for the hospital, as well as compromisation on the quality of care. So but as of now, till now, I hope I am very much clear on that average length of stay and occupancy rate are both very, very important, as well as very, very sensitive indicators of the hospital management. So this is all for today in this topic, and thank you so much. So we'll go to our next lecture. Thank you so much.